Hi, everyone. I hope you're having a great holiday season. And I can't tell you how touched I am. So many people said, hey, where's your next update? Where's your next post? In the midst of you celebrating your Merry Christmas or your Happy Hanukkah, it's about to start, that each of you, I'm so blessed with so many angels in my life, people I've worked with all over the country, people who've lived in other parts of the world that I'm friends with, people I've lived near, even my neighbors here. Everybody's been so kind. And you go through cancer and you go through something like this and you realize that there's so much good in this world and you keep putting good out there and it will come back. So I feel so incredibly blessed. My update is that my surgery is a double mastectomy. It's scheduled for January 3rd. January 3rd will be a little more than 2 months since the day of my original diagnosis, which, if you've been following my story, happened right after I celebrated the 5th anniversary of being cancer-free from AML leukemia. I haven't done an update in a while because, frankly, every time I try to do it when Gabriel's at school or Gabriel's not around, I don't have a lot of time. And it's normally that I am in tears over something, just kind of chasing the scans, chasing information, hearing over and over, which is frustrating me beyond belief, is, oh, yes, this is a secondary cancer, likely caused from the initial cancer treatment. You've had full body radiation. You've had a lot of chemo. That means we have to change the way we do things. And hearing that over and over and over again frustrates me and makes me really want to advocate more about how we can't just focus on fighting the initial cancers and check us off as a success and move on and say, that's it, when then we're going to have to fight a secondary cancer. Healthcare operates in silos. Everybody stays in their own lane. Nobody really, I feel like, this is my impression, that nobody really talks. And then you become that success, you move on, now you're somebody else's problem. And if we're causing secondary cancers that put us in someone else's lane, my point is that we really need to talk. But back to my surgery, I'm going to have a double mastectomy with deep flap, which means that because of my history, I cannot have implants. I also can't have tattoos to replace anything. So because there's leukemia risks. So I can't have the tattoos, can't have implants, according to my doctor. So I'm also have a hernia that needs to be repaired. So it's going to be an 8 to 10 hour surgery. There's going to be in that surgery room, the breast cancer surgeon and the plastic surgeon. The breast cancer surgeon will be in there for about 3 to 4 hours of that. She will be removing my breast. She'll also be testing the actual cancer. I still have pain on the left side. The cancer's on the right. Because of that, they're going to test the sentinel lobes, the lymph nodes on both sides, and also send that in. During that 10-hour surgery, 8 to 10 hours, they are going to send those into pathology, get the results back, and if there is cancer in the lymph nodes, during that time, then they will decide they're going to remove those. So I've already agreed that they can do that. We won't know the next steps until after the surgery of the size of the cancer they found, if it's in the lymph nodes, what kind, they did their initial stuff ahead of time with the biopsies. When they have more answers, when I wake up and I can process what's going on, then they'll tell me what the next step is. But that next step is going to have to factor in my baggage, my history. I can't have any more radiation. So if the standard protocol calls for radiation, they have to find another route for me. The chemo is going to have to, if that's needed, that's going to have to pass through my leukemia oncologist to determine how much did I have, can I have more, or do they need to find another route to do that as well? So there's a lot of factors that come into play. I've had to meet in advance with people because I have built up antibodies to blood transfusions from all the blood transfusions I've had. I have a low resting heart rate, so I had to meet with anesthesiology in advance because my heart rate can go from 39 to 41. So all these extra steps is just anxiety. And on top of that, having to hide and keep this from my son, from Gabriel, who knows something is wrong. But I didn't want to ruin his Christmas. We don't want to do that to him. We are going to have a talk with him after we have Christmas so he can celebrate his Christmas, enjoy his Christmas, open his gifts, and maybe on the 28th, perhaps we'll tell him before my surgery. I know it's going to be tough. My sister, my hero who saved my life, has really been so busy with issues at home that she hasn't been able to spend time with me. She's going to come and be with me for my surgery for 10 days. That will allow Caesar, my sister, to be there during the actual day of the surgery, but then each night, the 4 to 5 days that I'm in the hospital, that my sister can sleep there with me, and they'll wake me up every hour to check on me. so she's not going to get any sleep. But at least that would allow Caesar to be home with Gabriel to minimize any anxiety and stress for him. And when they feel it's appropriate within that 5-day window, they can bring him in to see me. And then I have friends who've signed up for a separate calendar, different friends who can come spend the day with me. I'm going to have 8 drains coming out of me that have to be poured out, whatever, over every 3 or 4 hours. So I'm told it's going to be messy. It's a very different process than the leukemia process of how you treat and go through this to become cancer-free. And so I have different friends who are going to come stay with me once my sister leaves. And I'm so grateful, again, for these angels who have offered to come stay so Caesar can go to work. And once in a while, take a day off to help at home as well. So that is the update. It is the 8 to 10 hour surgery. I'm very stressed about it. When I get home, I cannot drive for 4 weeks. I'm also told I'm going to be in a lot of pain, that I can't do any laundry. I'm not crushed about that. Caesar might be. I can't do any dishes. They said my focus for 4 weeks, I'm going to be in a lot of pain between the lymph nodes, between the breast, between the hernia, between the stomach that they're going to use to make the breast. I'm going to be in a lot of pain. It's going to take me 4 weeks to be able to just do anything for anybody. And I just need to focus on taking care of myself. That being said, what I did want to talk about is the secondary cancers and how I think that my message, if you're a survivor, is I've learned that we need to try to put more focus on not just treating the initial cancer, but we need to focus on the secondary cancers as well. And because if you look at the research, there's nearly 16 million of us who have survived cancer, and that's great news. But if we come out of it broken, and many of us face secondary cancers later on, we can't be forgotten. We need someone also there to help us. And I've noticed that the healthcare system operates in silos. Everybody stays in their lane. The breast cancer people stay in their lane. Leukemia, blood cancer people stay in their lane. But if we're causing other cancers by treating the initial cancer, they need to talk. And that's basically what I've had to do. I've had to advocate and say, no, you guys need to get on the phone. I mean, they're going to do a DNA genetic testing. They're going to test my DNA and know what markers I have by doing a skin biopsy, because they can't do my blood, because my blood is 100% my sister. It says 100% patient, 100% of my sister. It says no evidence of patient. So all of these factors, I've had to really bring everybody together on my own and say, you guys need to talk. Like, how do I proceed? And so my message to you, if you're a cancer survivor and you go through, before you even ever face a secondary cancer, I hope you don't, but before you do, know the dose and know what kind of treatment you had. And you need to be able to tell other doctors, hey, I've had this. Does this factor into the treatment you need to decide for me? And then also, if you are faced with a secondary cancer, then you need to find out and see how you can get everyone to talk and be on the same page and understand your history, because it does play a big role. It does impact your body and how it functions for the rest of your life. It's been very eye-opening for me, and I'll be sharing something I've been writing soon. Anyway, that's the bottom line. It is going to be January 3rd. Please say prayers for when I have to talk to Gabriel. Caesar's going to talk to Gabriel. I try to kind of prep him and tell him about our dog, who many years ago had cancer on her belly, and that it was cut out and she didn't feel well and she laid on her bed. And it's true about our dog Bella, who we had many years ago, and that she was fine, lived a long life. And so by telling him those stories when he asks about cancer, I hope that that kind of lays the foundation for when Caesar's going to talk to him first, because I'm going to be a mess. And then we're all going to talk together as a family. I hope all of you have a very Merry Christmas, Happy Hanukkah, and thank you for everything. I will pay every bit forward. All the good and kindness that you've given to me, I will continue to pay it forward and help not just you if you need it, but other patients in need. I hope you have a great day, and don't forget to armor up, prepare, present, prevail. You are preparing your body each and every day with what you do. If your world flips upside down, think about what you eat, how much exercise you get, the toxicity you allow in your life, the stress right now. Everything you do is preparing your body for illness. And how well you go into this illness, just like how well I go into my surgery, is going to determine how well and easy I can come out of it. I've been doing some of my own prehabilitating. I've been doing some acupuncture, which is preparing my body for this surgery. I've been doing a lot of yoga, whatever I can within the means that I can. So you have a great day. Don't forget to armor up. I'm sorry, it's a long message. God bless. Have a great day. Armor up.